Lord bless you for great are your blessings on this new project, new initiative. And may all women who come here, husbands, be glad to deliver children for our country and for the world. May your blessings be upon this building, upon the doctors and upon the equipment that will be used to help many people generate offsprings for themselves and for our nation, the Gambia. Make our prayer through Christ our Lord. Amen.
Shut the door behind us. Thank you. Thank you, thank you, thank you. Okay, so my name is Ife. I'm a clinical embryologist. What it means is, in clear terms, I'm like a priest or an imam that weds the egg and the sperm together. Okay, that is my job in a nutshell. Okay, so where we are right now, and welcome to Repro Care at Elemats Fertility in the Gambia. Now we have something like this, even though bigger, in Abuja, Nigeria. But then I can tell you that the quality of equipment that we'll have here is just, the difference is the size of the building, but the quality of the equipment we'll have here is same as what we have in where we're coming from, okay? So where we are now is where the doctors come in, you know, wash themselves, clean up themselves before proceeding inside for the IVF. Sorry, so you come in with me. Okay, so here, what happens here is the woman or the couple, depending on who is here, the doctor sits down with him and discuss here, you know, on the what we are about to do. Okay, talk to you about if it is embryo transfer, if you are trying to collect your egg, we'll first of all have a brief conversation here with you before sending you inside. Now, after we're done talking with you, the embryologist or the scientist like myself will go in through this door, and the doctor themselves will go in through that door. The patient also goes in through this door, okay? And we, the scientists, will go in through that door, okay? I'm sure we've heard of one or two persons, you know, probably suffering cancer, or a man or a woman, and you know that there is this drug that is called chemotherapy that they will have to take. And we know how toxic and how hard it is on your body. Sometimes it is the chemotherapy that even kills them. You know, if it can kill somebody, imagine what it does to egg and sperm. Okay, so one of the services we offer here at Elemats is to help people not lose their fertility because of chemotherapy. You see people go and have cancer treatment. By the time they are back, they are now fighting another sickness, which is infertility. Okay, so a good hospital will tell the patient who still wants to have children, before you go as a man, before you go and you do your chemotherapy treatment, go to a center and freeze your sperm. As a woman, before you go into that, go to a center and freeze your eggs. Okay, they must tell you that, the good clinic will tell you that. And again, as a woman too, if there there is no partner in sight, husband is not coming, nothing, instead of you delaying till later when you might have lost all your good eggs, it's better now that you're still young to come in for what we call fertility preservation, where we have to preserve your eggs. And how do we preserve it? It's very simple. We store them in this tank. Okay? So they can be here for 10, 20, 30 years. As long as you want. You just pay for us to continue to store them in storage tanks just like this. As long as this thing is coming out of it, it's called liquid nitrogen. As long as we have liquid nitrogen gas supplied in the tank and it is coming out of it, nothing will happen to the egg. It's only when you open and nothing is coming out, you know that they are dying. Okay? But as long as there's liquid nitrogen supplied inside of it, you can stay here for over 30 years and nothing is going to happen to it. Okay? So now, after the doctor and the patient finish talking, like I said, we go in here. Now, this is where they come to. Okay? The patient lies here. The doctor sits here with the help of this machine and this pump. This, just like a pedal here, is able to get out the egg. Okay? Now, when you get out the egg, you pass the egg or the fluid that you collected, you pass it through this window. There is a window here. Okay? You pass it through that window, and that ends it for the doctors. Okay? Now we go in here. Lab. Okay, andrology is everything that has to do with sperm, semen. Okay, so the same day the woman goes in there to have her eggs retrieved, the man also produces the semen sample and gives to the andrologist. Now, when we collect the sperm, we see that it looks like a mucus. Okay, now that is not what we need to work. So with this, we are going to separate the mucus from the swimmers. Okay, so with this machine, we are able to separate the mucus from the swimmers, and as soon as we are done with that, we collect the swimmers in the tube just like this, and the andrologist passes the tube containing the swimmers to the embryology. Okay, so we are moving to the embryology. Okay. So this is the embryology lab. This is where everything happens. This is where everything happens. This is the connection between the theater where the doctor passes the fluid to the lab. Okay, so the job of the embryologist simply is to collect whatsoever you can collect from the doctor, and with this and the microscope, I'm able to pick out all of the eggs. Okay, I'm able to pick out all of the eggs. And after that, I collect them in a dish, in a plate, containing reagents that should help them grow. And then I put them in the incubator. This incubator is CO2 incubator, carbon dioxide incubator. And that is what the embryos or the eggs need to continue to grow. Okay, if the sperm is good, everything is good, then you just put it here for 3-5 days. And after that, take it from here and we send it back to the doctor to put it back inside of the woman. Okay? But if the sperm is not good, after we collect it from here, this man has to work on the sperm. So this is the ICSI machine. A lot of centers, I say it because I'm not just Nigerian trained and all that. I've worked in Switzerland, I've worked a lot of places. A lot of big centers do not have this machine. Okay, so it's a privilege and it's a blessing also that we have this in the Gambia. Okay, this machine is what also helps. When the sperm is very bad, okay, this machine helps to pick out, even if it is one sperm that the man has, this machine can pick it out and then inject it with this and that. All I just do is walk like this, okay, looking at the microscope and watching at the screen, I'll be able to inject the egg into the sperm into the egg, okay? So it's not enough that we have you clothed, covered, ensuring that what we are trying to do here really is to mimic nature. Okay, that's what we are just trying to do. Okay, we're trying to mimic nature, and you can tell me that inside of there, where this thing happened, there's no dust, there is no paint smell, sand, or anything like that. So that's why we have different checks, you know, to reduce it. And it's not even enough that we are asking you to cover up. And the day that you, if at all you'll be coming for the IVF, you know, the day you'll be coming, they'll give you strict instructions, no perfume, no, that is when the actual thing is happening. So we are trying to control smell and things like that. Now, it's not enough that we are covering you up and bringing you here. We also have this machine here. Once you step out, all I just need to do is to press something and it will suck every impurity, both the one we see with our eye and the one that your shoes drop, it will suck it in. It's called an air filtration machine. So it works 24 hours to ensure that this place is clean at all times. Apart from our physical cleaning, you know, if you touch the wall, you can't see any dirt, not even dust, because we are doing that 24 hours. We are always cleaning. But we still have this machine here to also do a deeper, like a vacuum, like a deeper cleaning for us. Okay? So you're welcome to Reprocare Elemats, and that's all I have for you. Thank you.
Thank you very much.
You're welcome.
This is very impressive, and hopefully everybody that is looking for will find it.
Amen.
Yes.
Thank you so much. Immediately we have started. Yes.
Me no know why them a go so young. Them a worry and fret. Them a worry and fret. Your boy Sing Out here once again. Keep watching Asagam TV 24 hours. Keep it locked.